On PM Express tonight, limiting the spread of COVID-19, the lockdown effect. Many of us, many of you are in homes right now, spending the first day of the lockdown. Tonight, we're going to look at how the lockdown can be used as an effective tool to win the battle against COVID-19. That's what we're doing tonight. We know that the two-week lockdown of parts of Accra and Kumasi started 1 a.m. On Monday. That is today. As you can see, the streets have been deserted largely. The president announced the partial lockdown on Friday following, as we know now, several calls for him to do so, including a very powerful one from the Ghana Medical Association. And they're joining us tonight on the first day to assess how it's gone so far. We see impact already at the hospitals tonight and what they make of the effectiveness of the targeted lockdown that we've seen. Now, you could land in jail for up to 14 years for disobeying the government's social distancing directive, and that is very important for you to pay attention to. Also, the imposition of the Restrictions Act slaps 1,000 to 5,000 penalty units, which translates into 12,000 to 60,000 fine on those who breach the law. If you don't want to pay these fines, just obey the instructions as the president himself had announced, including staying at home. As you can see, there have been a fair bit of chaos when people anticipated what was going to happen today. Prior to the lockdown, there were videos of many people moving to other parts of the country that are not affected by the lockdown. That has led to concerns in these parts of the country where many left in droves. The exodus that we've seen, that they may be carrying the virus and spreading it to other parts of the country. We will assess the impact of this with the experts we're about to engage here. The markets have been choked also. There were also concerns of panic buying as markets across the country saw people choked in foodstuff, buying foodstuff in preparation for the lockdown that has now taken effect. Now, on day one of the lockdown, people are expressing discomfort already. This is not going to be comfortable, but that is what we all need to endure if we have to win this particular battle with COVID-19. Also, we know a few more concerns have emerged. There have been concerns over price hikes, and people are asking the Agric Minister to impose some form of price controls. He said that is not possible, especially at the time that he believes we have a glut and surplus of some of the key staples that we eat here in Ghana. Now, the greatest fear, though, that many people may have is that the 48 hours prior to the lockdown, many have already been in a position to spread the virus quite widely. The key question to ask tonight is, what is the effect of this lockdown? We're going to be exploring the lockdown effect tonight, but most important in looking at how this particular lockdown helps us win the battle against COVID-19. What to expect in the next 2 weeks. Is this just about staying at home, or the practical measures that government needs to take? And we've had a few. We'll be assessing them with the experts. Stay with us here on PM Express. And thanks for staying with us here on PM Express. My guests who are joining us all via Skype tonight is Kingsley Atu-Coleman, who is the emergency expert, former country director of Plan International in Sierra Leone at the time when they were dealing with Ebola, and comes to this conversation with great experience dealing with that particular viral outbreak as well. He's and also an HR and change management expert and a fellow of Imani Africa. And we're grateful that you could join us, Mr. Coleman. Also joining us via Skype tonight is Dr. Michael Owusu. He's a research scientist at Department of Medical Diagnostics at the KNUST. He's also a researcher with the Kumasi Center for Collaborative Research. That is the second accredited agency in Ghana for testing for COVID-19. I'm grateful that, gentlemen, you could join us here on. I want to start with you, Dr. Michael Owusu. And what you had all along said, targeted lockdown is what will be most effective. This is the one of precisely that targeted lockdown. You work in KNUST. You work in KNUST, but you also are the researcher, the collaborative research and CAF. What's your assessment of the one so far? Let me bring in Mr. Coleman. Let's see if we can fix that connection to Dr. Owusu there. Mr. Coleman. And thanks for staying with us. Apologies for that initial hiccup with the connection to both Mr. Coleman and Dr. Michael Owusu there. I want to bring in Dr. Michael Owusu, who's on the line from the KNUST. Doc, I was asking you what your assessment is of day one. This is, I guess, what you called for, a targeted, precise lockdown informed by data. What's your reaction, though, first of all, to the measures that the president announced and how targeted they were?
So a very good
We still have a challenge with that connection. Let's see if we can hear from Mr. Coleman, who is also on the line with us. Mr. Coleman, can you hear me? Hello, Mr. Coleman.
Hi, Evans.
Yes.
Yes, hi, Evans.
Great. I can hear you loud and clear now. So whilst we fix the challenge with Dr. Owusu's line, Dr. Owusu, let me see if I can hear you.
Hello, Evans.
Great. I can hear you now. I was asking you, because you had consistently called for a targeted lockdown approach, what's your assessment of what the president announced on Friday?
Yeah, so
let's talk about the lockdown as we've had it. Subsequent to the lockdown, we've heard the government announce what plans they have during the next 2 weeks. You worked in Sierra Leone during its Ebola outbreak. Based on your experience, what is the best strategy during the lockdown? Well, Dr. Michael Owusu is with us. He's research scientist, Department of Medical Diagnosis, KNUST. Doc, let's try again. Can you hear me? So clearly, the challenge with technology in the time of coronavirus pandemic, obviously we cannot have people in the studio. There is a lockdown. The obviously challenges with the Skype connection. We're going to put them on the phone and see if that works. Thanks for your patience. We're all trying to manage through this period of great uncertainty, even for the media. We'll be right back.
You have to first run a gel, so this will take a very
We move the entire conversation to the phone lines now. Let's see if this time Dr. Owusu can hear me. Doc, can you hear me? I have Mr. Coleman instead. Hello, Mr. Coleman.
Yes, Evans, I can hear you loud and clear.
Well, fantastic. I was asking you with your experience from the Ebola outbreak in Sierra Leone, where, of course, you were a very important part of dealing with this. What's the best strategy in dealing with a virus such as this during a lockdown?
Thank you, Evans. I think the best strategy for such a pandemic is to, first of all, for this particular COVID-19, is to implement the 4 key enablers for halting the disease. The first is surveillance, isolation, testing, treatment is number 1. The second is social distance. The third is practicing the water sanitation and hygiene protocols with a lot of emphasis on community engagement to drive that. And then the fourth is building an agile response infrastructure which can be scaled up if the disease escalates. So for me, these are some of the four key elements of a good strategy to deal with a pandemic of this nature.
I mean, it's curious. The government has announced what its plan is. Again, one of the key things they want to do is to test. Now, how do you set up the execution of a lockdown during such a complex humanitarian emergency?
Thank you, Ivan. You need to look at what I call the organizational design of the entire response infrastructure. And for me, there are about 8 elements that you have to look at. The first is what I call values and behaviors. Values and behaviors to drive the response, because the global humanitarian standard has 7 core values that should always underpin any response project or program. So if you look at the core humanitarian standard of 2018, which is more or less overarching framework to guide actors in a disaster risk response situation, first of all, you have to treat affected population with dignity, number 1. That's the first value. And number 2, you also must respect the fact that they have a right to assistance. That is number 2. Number 3, you have to respect their local traditions and customs. Number 4, you need to be impartial so that you don't use the aid or the response to drive a particular political or religious standpoint. So for me, these are the values that have to be defined that should drive the behavior of all the human resources that will be part of the response. So number 1. Number 2, you need to have an organizational model that helps you to manage the technical people and the operational people. So what am I talking about? If you look at this disease, you will see that there are 3 or 4 main core pillars. Number 1, there is the epidemiological aspect. Then there's the surveillance aspect. Then there's the laboratory aspect, which is responsible for the testing. Then there is the infection prevention and control aspect. That is one broad pillar. Then you have case management. Then you have social mobilization, community engagement, and risk communication. And then you need to have resource mobilization, because as the response is unfolding, you need to mobilize funds to be able to scale up and deliver essential services. And then more importantly, you need to have what I call the knowledge management infrastructure. That is to make sure that you are monitoring and evaluating and learning and reflecting as you deliver the response, so that at the end of the day, you can document what worked well and what did not work well. So it prepares you and builds your resilience for future situations like that. Then the third part for execution is what I call operational excellence. Now, operational excellence refers to your standard operating procedures, your business processes, your standards, your systems for assuring quality and accountability. So here I'm talking about your SOP for logistics, for procurement, your SOP for case management, your SOPs for infection prevention and control, your SOPs for hiring responders and volunteers, and so on and so forth. So operational excellence is important, especially when you also need to ensure that you have built in the right checks and balances to avoid fraud and corruption, to enhance accountability. That is very important, because it has been documented that, and by experience, and from experience in Ebola, not only in Ebola, but also during the Sahel food crisis in Mali and Niger in 2012, you see that, and also even in Haiti, when you look at the Haiti earthquake disaster, most of the times during humanitarian response situations, you also have the risk of fraud, and people try to steal. So operational excellence is very important to have the right SOPs to look at all these business processes. Then the next aspect of execution is the leadership. So what I call the command and control aspects of the leadership. So you need to have clarity on decision states and decision mandates, reporting lines, who is responsible for what, who is accountable for what. That is also very important because you need leadership to also manage the coordination of the role of other actors. Because during such an humanitarian response situation, you also have other non-state actors involved. So you have NGOs, you have faith-based organizations. But in order to ensure synergy and to avoid duplication of efforts and needless conflict, you need to have a solid command and control leadership structure that defines responsibility and accountability. Then also you need people. You need people with the right skills. So I mentioned some of the skills that we are talking of here. You need psychology. You need economics. You need epidemiologists. You need laboratory technicians. You need logisticians. You need sociologists. You need monitoring and evaluation expertise. You need this broad range of skills and expertise to deliver the execution. Then also importantly is data. Everything during a response must be driven by data. So it's not based on gut feeling or emotions. So, for example, you need to have a baseline of what the situation is, and then as you deliver the services, you can always monitor and evaluate if you are on the right path. So, for example, if you look at some of the data that we are looking at, it is clear that there's a certain trend. If you look at the number of imported cases that came in, a lot of those who have tested positive came from outside Ghana. Now we are also estimating that between 3rd March and when the president announced the closure of our borders, between 50 to 70,000 people may have entered. Now, so if you do the basic calculations and you look at the fact that behind every index case there is a primary contact and there's a secondary contact, we are looking at some numbers here. And so I will not be surprised if our numbers go up. But again, this has to be based on data and projection analysis. The last but one factor for me for an effective execution is information, communication, and technology. You have to leverage social media. You have to leverage IT infrastructure, especially when it is shut down, when everybody has to stay home. You need to make sure that you have your ICT infrastructure well laid out. People are able to send information. You need a lot of intelligence. You need a lot of feedback mechanisms to guide the direction of the response strategy. So ICT is very important. And then last but not the least in terms of execution is the governance. So the governance looks at who has overall accountability to ensure that the intention and the objectives behind the response is delivered. So here you are looking at ultimate governance resting at the president's level and then his core cabinet, who at the end of the day are going to be held accountable for this response. So for me, this is how you set up a response to deal with such a situation.
Let me bring in Dr. Owusu. Dr. Owusu, you're going to give me your assessment of the President's directives. Hello, Doc. Dr. Owusu, can you hear me? Okay, it appears Dr. Owusu can't still hear me.
Hello, hello, Ivan.
Yes, I can hear you. You were going to give me your assessment of the President's directives and day one. What's your assessment of day one?
Yes, so I've gone through the President's directives and look at his action plan and clear objectives with regards to this lockdown. And like I always have said, the WHO has made it clear that lockdown by themselves do not extinguish epidemics or pandemics. But then when you want to pursue lockdown, you must be guided by some principles. And they lay down 4 of this. The first is that it gives you a window period to expand, to train, to deploy your healthcare workforce. It also gives you the opportunity to implement a system to find every suspected case at the community level. It enables you to ramp up production capacity and availability of testing, and then to identify facilities for quarantining and then for places that you want to equip. Now, if you go through what he mentioned, you could see that he touched on most of these that are recommended by the WHO. One is that he said that the objective for the lockdown is to limit the spread of the virus, limit it through importation, and limit it through active search for cases. And for me, you see, if you pursue a lockdown based on availability of data like he has done, it enables you to channel all your resources and manpower into these areas to search for the active cases. It is these active cases that will enable us to know and understand the true burden of this virus circulating around this place. So for me, you could see that he laid out a clear action plan, talking about recruiting about 2,000 volunteers and community health nurses to go to all these hotspots. He has data of all the people who came in before the mandatory quarantine. He will follow them up and ensure that he does a house-to-house testing of all these people. And I believe that by the end of this, we'll be able to know that, yes, before lockdown, we had a prevalence of about 63 out of a certain population numbers. After the lockdown, we have been able to find significant numbers of this. We have brought them out from the community, and we are following them up and doing contact tracing. I think with these lines of objectives, I'm quite reassured that if we are to pursue this aggressively, then, of course, we'll be able to make advances in terms of bringing this prevalence down. And one other thing he added was that he will add, in addition to what he's going to do, he's going to add an intensive public health education and community awareness of social distancing and hand washing. And for me, if you look at the behavior of the virus at any point in time can infect 2 or 3 people. And this is based on multiple contacts. As you implement your isolation, as you implement your quarantine, as you implement your lockdown, as you search for active cases and then isolate them, you are able to cut down the growth rate of the virus to about 0.5. Where if you are lucky, it will get to a point where you will be able to extinguish the virus within the lockdown area. If you are not able to do this, what will happen is that after 14 days, you are likely to have a group of people who may have the infection. They may come out of the lockdown areas and reinfect a new population of people who are susceptible. So if you have a curve that will rise for 14 days and fall, and then you have people who are susceptible, and then another curve has to rise. So you may have to do lockdown for 2 weeks, another 1 month, and that will be quite difficult. So I feel that channeling with the meager resources we have, channeling these resources into hotspots, which we know by data, will afford us the opportunity to target these areas and put in our very best. And it's my hope that after the 2 weeks, we'll be able to identify all these cases and then at least begin to deal with them and isolate them. And then through that, we should be able to manage this.
You talk about hotspots, but we know that thousands of people left Accra and Kumasi for other parts of the country when the president announced the measures. What's the risk in that? And have we lost that window to really be effective with the targeted areas in these hotspots?
Yes, I was quite worried. I mean, when I saw, and also heard that quite a number of people were moving away from these areas to other areas for reasons that was quite difficult for me to understand. But then if you look at the data available so far, I mean, in Kumasi, which is handling the northern zone, we have 9 cases, which is based on community disease surveillance or routine surveillance out of 258 tests. This is about 3.4%. In Accra, test done by Nguchi, if you look at, if you take out the mandatory quarantine ones, those ones that they tested from routine surveillance, they did about 1,276 tests, out of which they have 44 positive. So in Accra and Kumasi, you are dealing with about 3.4% prevalence. Hello, Evans?
Yes, I can hear you, yes.
Yeah, so you are dealing with about 3.4% prevalence, which for me, the risk that people will move this to other susceptible population elsewhere is quite low for me. I think that for many who imported the virus before the mandatory quarantine may still be in the system. And if we are able to use the data available from immigration, we still have some window of opportunity to trace all these people and target them. And I'm also told that the disease surveillance units have been deployed to all regions, which means that it's not just the hotspots in Accra and Kumasi or Tema which are being targeted, but then active information is being collected at all the regional capitals, such that once you have any of these cases show up there, there should be able, there will be that active search for these people, and they will be able to deal with them.
But the prevalence rate, Doc, the prevalence rate you talked about is only based on what we've managed to test, and clearly we haven't tested anything close to enough. I mean, isn't there the real possibility that there are far more people within the population carrying this virus that we have no clue of, because we haven't tested enough. And these individuals may now have left Accra and Kumasi and may be spreading this even widely. That is the great unknown, is it not?
I agree with you. It's a greater unknown, and I will have wished that all these people stay within for aggressive testing to be done for us to know. It's quite unfortunate that we had these huge numbers move. But I've been looking at data from elsewhere, in Italy, for instance, where people moved, and you could see that as at the time they moved, the extent of the disease was quite massive. So you could already predict the movement of population and possibility that these people will move to other areas. I'm just looking at how many we may have on the ground. And perhaps I think it's not all lost. I want to believe that. I feel that we should begin the process, because if you widen this lockdown to other areas, your capability to test across all the regions will be quite limited. The president mentioned that he's now going to bring about 40,000 test kits, which are yet to come. The ones available are about 50,000, which is to be used for the hotspots. And even this, I feel, is not enough. So it is better to channel your huge resources into areas that are highly populated in Ashanti and in Kumasi, and to deal with this massively and to ensure that this is extinguished at the heaviest population. And then you can gradually mobilize to less dense areas across, and then do more of individual targeted households and communities, and then you can deal with it. When the risk factor is large population, crowdedness, moving, and then doing all sorts of things. And in Accra and Kumasi are the largest areas that you have a lot of headache if you have to have this happen. So for me, channeling resources to do this in these areas is quite worthy. It's my hope that we don't have this trigger in other areas. And because the population there are less dense, I feel that even if it happens there, it is possible to quickly spot these areas and then close in and then deal with it on case-by-case basis.
Let me bring in the General Secretary of the Ghana Medical Association, Mr. Justice Yankson. Mr. Yankson, thank you for your time here on PM Express.
My brother, most welcome.
And let's start with, you are in the hospitals. Are you seeing the impact of the lockdown yet? I'm just wondering whether traffic to the hospitals have reduced now, and now you're getting clarity on which of these patients you will give priority to because maybe they are coming in with COVID-19 symptoms. What is your assessment from a medical practitioner's point of view of day one?
Well, it depends on where you find yourself, but generally there seems to be some reduction in terms of the numbers that are trooping into the hospital for medical care compared to what existed before this time.
What's your assessment? So you've seen the reduction in numbers. Has that improved conditions at the hospitals where your members are generally?
Well, when you say improved conditions, I'm not too sure what exactly you mean.
Because we heard reports about people simply trooping to the hospitals before they even had called, and that then was exposing, because you didn't know who was coming and what symptoms they had. If the places were congested, you're exposing health workers to more risk. I'm just wondering whether that pressure has now reduced, and so more triaging in an atmosphere that is more manageable is playing out in many of the facilities that your members work.
Okay. Well, prior to the lockdown itself, some of the facilities, especially the bigger ones, had instituted some kind of triaging method, some kinds of cutting down of numbers depending on where they found themselves. So they had put up notices saying that, well, certain kinds of cases should report to their community hospitals or try to get some first aid or go for their chronic disease medications from nearby pharmacies, stuff like that. That has been running for a couple of weeks, and that seems to have gotten well done with some of the people. So people who ordinarily will come in for just a refill of their medications because they come in at 2 monthly intervals or 3 monthly intervals, 7 monthly intervals, were beginning to go to the pharmacies, and then when they go, they show their previous prescriptions, or they get to talk to their doctor on phone that, look, this is what has come to us. So those kind of measures had sort of started streamlining the OPDs to an extent where the huge congestions that we used to experience was beginning to give way for all the good practices we are talking about, the social distancing and all that. And then today, this bit also came in. There was limitation in terms of general transportation around. People were more or less obeying the stay-home order. So most of the hospitals, yes, had cases to see, but the numbers were relatively manageable. And I think that is one good bit. The only thing is that for those who are severely ill and what have you, we will still have to continue to see them. And that is the right thing to do anyway, because prior to COVID-19, we still had our diseases that we were already contending with, and that will have to continue. So I think we are beginning to get a certain balance that ultimately will help reduce the high risk that people were exposed to, especially in hospitals.
And let me ask you this. The Ghana Medical Association proposal was for a nationwide lockdown. You've seen how this particular version of the lockdown has been implemented and what transpired between Friday evening and 1 a.m. today. What's your assessment? What's the GMA's assessment then of the way this particular lockdown has been implemented as against what you proposed?
Well, for us at the GMA, we made our recommendations known to the whole nation. The president, in his own wisdom, trying to do a balance between economic activity and, COVID prevention and what have you, based on also advice from some of his advisors, came up with this variant of the lockdown. Unfortunately, the 2 days prior to the lockdown has sort of almost made noise, mincemeat of what really was supposed to have happened. We didn't want people to move in droves. We didn't want people to spread the disease and what have you. But unfortunately, people have moved out there in their droves, and they've now scattered to all the 16 regions of the country. So unfortunately, if there are cases of COVID amongst those who are moving all over the place, some will end up infecting people in the buses they travel in. They may also end up introducing the disease into their communities, which either two had no COVID. But unfortunately, this is the price we've had to pay for this variant. Hindsight, one would have said that maybe the president should have locked down the nation the very first day he spoke in terms of the areas that he locked down. Others also believe that, well, maybe from the word go, we should have just stopped human traffic all around us, and then all this would have been a thing of the past. It even just didn't start with the people moving out of Accra, but even the people within Accra. Go to the markets, what have you, Saturday, Sunday. It was just chaotic. Nobody respected the social distancing that we were talking about, because I don't know whether it was panic or whatever it was. So those 2 days, to a large extent, may have set us back in our fight against COVID-19, but I'm sure we'll recover.
Dr. Wusu, what will success look like after the 2 weeks?
Well, success looked like, for me, in terms of the cases, I'm looking at both the health facilities and also data availability from testing. I'm hoping that after the 2 weeks, we'll be able to know the number of people that we will identify in these regions that have been locked down. We should be able to tell how many tests we have done and how many have come out as positive. We should be able to tell how many people have been quarantined or how many contact tracing have been done in these areas. I also want to believe that within these 2 weeks, we should be able to know how many people will report to the hospitals with signs and symptoms of COVID, and how many, if people who may have to lose their lives within these areas while this place is locked down. So it's early days yet, but I think that if we begin to record increasing numbers of people reporting to health facilities with signs and symptoms of COVID, and then increasing numbers of people being tested, increasing number of people coming out as positive and being quarantined and being isolated, people being educated about issues happening, then we can weigh these against what we knew before. And now we'll be able to tell whether whatever we have done has been successful or not. And like has always been said, if you lock down and you don't administer an aggressive intervention, then your lockdown will not make any meaning. You are only locking people to stay home, awaiting 14 days to come out and reinfect a susceptible population, and then restart another 14-day cycle. So for me, I think that this is the time where all energy must be put on board to ensure that the very reason why we are locking down, we achieve our objectives before this lockdown is over.
And very finally, will the 2 weeks be enough, knowing what we are learning from other jurisdictions?
Yeah, so I have had calls with some of the regions, in the Ashanti region, for instance, and have asked of their clear line of action and what they are doing. And from what I have been told, that you have close to 500 volunteers who are moving, who have data of all people who have come into the region, moving from house to house. People that our center is well prepared to receive the number of tests that cases that will come to our facility for us to do the testing. So I think the preparation for me from yesterday and today, as I have learned, I think there is more seriousness that has been attached to this. It's early days yet, but it's my hope that with these plans laid down by the president and then the director of the Ghana Health Service, once we are able to do this, I'm sure that we should be able to do it. If we are not able to do it, my fear is that after the 2 weeks, we should be waiting for another group of people to reinfect another population and to ask for another 2 more weeks to lock down, which would be a bit distressful, which would be difficult for people to contain, looking at the economic balance, the socio-economic situation of many people who are in the country. So I think that the window period is still there for us to be able to target this in a hard way and ensure that we extinguish this once and for all, so we can reserve much of our resources to tackle other areas which is much needed to help the development of our country.
Mr. Coleman.
Yes, Ivan.
Yes, finally for you, just briefly drawing on the Sierra Leone Ebola issue, it's almost certain now that we are going to have a curve that is going to go up before it drops. How do we cope with more cases?
I think we have to focus on community engagement and social mobilization using community structures and leaders, the faith-based leaders, the imams, the traditional chiefs, the traditional direct attendants, so that they can drive the behavior change. Because the best strategy is social distancing and also applying the wash practices. I think it's very important. Washing your hands with soap, applying sanitizers, and so on and so forth. So investing in social mobilization and community engagement will be key. Resourcing the health workers and the respondents who are at the front line of this response. So making sure that they have the resources available. And at the same time, balancing the speed of the response with the integrity of the response. But I keep on highlighting the fact that in the midst of disaster, people also try to steal funds.
Absolutely, and I guess that has been the main concern now that we are talking about a fund to assist, etc., etc. I'm grateful, Mr. Coleman, for joining us with your thoughts on this, and apologies for the challenge at the beginning of the show with the lines and the Skype. Casely Coleman is a complex emergency expert. He's a former country director with the Plan International, HR and change management expert, a fellow of the Money Africa as well. You also listen to Dr. Michael Owusu, who's a research scientist, Department of the Medical Diagnostics at the KNUS. He's also a researcher, the Kumasi Center for Collaborative Research, KCCR. And we heard from the Ghana Medical Association, the executive, the General Secretary, Mr. Yang Singh. Enjoy the rest of the evening.